I'm Karim Valji, and I'm an interventional radiologist at the University of Washington in Seattle. So the book covers the entire field of interventional radiology. From the second edition, I've added 2 new chapters, one on interventional oncology and one on neurointerventions to kind of complete, I think, coverage of the entire field. The major new feature of the book is that it is now online, which means a number of things. One is, of course, the book will be available to anyone that buys it, anywhere that they have access to the web. Ultimately, I hope that it will become an e-book, and then it can be read in an airplane or wherever you want to take it without having to lug around the text itself. But the major advantage is it's provided us with 2 new opportunities. One is to put online cases. So there are about 110 unknown cases that cover the whole gamut of interventional radiology, all of the basics that I think any radiologist should know. And they're done in a case style, so that images will be shown, questions about the images will be asked. There'll be multiple choice questions trying to test the knowledge of the reader in that particular topic. And it really appeals particularly to younger trainees who want a form of active learning. They're not as interested in passive linear reading as older readers are. And it's a good way for a radiology resident in particular to make sure that they've picked up the material that they need to know, or even learn it de novo. In addition to that, the third other feature is that there will be videos, and they cover everything from how to flush or manipulate a diagnostic catheter to how to perform a TIPS procedure. And they are both fluoroscopic clips taken directly from procedures or videotaped clips taken working at the interventional radiology table. And surprisingly, that kind of material is not that available in textbook format in our field. You can certainly see it on YouTube if you want to search for it, but to find a group of the basic procedures contained all in one text, I think is a fairly, at least at this time, unique feature of the book. So I think it, in addition to being an up-to-date review of the entire field, it provides some new material and new ways of learning that I think appeal to the new way that we're all learning to practice medicine. I would say one of the major ones is interventional oncology, and that is a rapidly growing area of my field. It probably accounts for 30 or 40% of the work that I do in my practice. The opportunities for treating patients are really unknown, and so that's the reason that rather than integrate that material into each of the chapters for the different organ systems, I've actually asked an expert who is well recognized around the world both for his research and for his writing to provide his take, or his group's take, on that field. So it's all contained in one chapter, which will give the reader a framework for understanding how we approach this, what is a very difficult disease. The neurointerventional section, that's also an area that's growing very rapidly, and I think was lacking in previous edition of the book, that's now provided for readers.